Hi, welcome to this hair care initiative by IPTA. I'm Mona Sharma. It's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have a thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided. Today, we have with us Dr. M. Sridevi is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS DVL, specializes in dermatology and cosmetology and hair transplant. She owns her own clinic, which named as Sridevi Skin Clinic, Hyderabad, Telangana. Dr. N. Sridevi has dedicated her career to diagnosing and treating a wide range of skin and hair conditions by providing personalized healthcare services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Sridevi is aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. M. Sridevi, for spending your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Thank you for having me here, and very good afternoon for all the audience and listeners who have taking this time and joined this live studio. I hope you find something, a good few topics regarding the hair loss and also how to maintain your healthy hair, as well as how to prevent your hair fall by following certain whatever you call a few tips and advices. So yeah,
Yeah.
we'll go.
So, Dr. Hamasa, directly Balwa Shukriya. So, Doctor, today we are going to discuss about, like you said, hair care in current scenario. And when we talk about hair care in current scenario, the most common problem which is faced by all of us, irrespective of gender and age, is hair loss. So, can you please enlighten us with your profound experience, like what's normal and when to be concerned for?
Yeah, see, the hair loss is the most common thing what we see in a day-to-day practice, right from the teenage children as well as the adults as well as even the elderly age group. So everybody is complaining the hair loss because it's the most important cosmetic thing which identifies ourselves. So everybody is concerned regarding the hair loss. So what we see generally is in the elderly age group or the teenage group, what we see is mainly because of the nutrition, because they don't include all the variety of foods. They generally have the food fats and they include only few kinds of foods. And when coming to the middle age group, it is because of the hormonal reasons. And one thing which is common in the middle age as well as in the early age, like young adults, is because of the genetic pattern of hair loss. It is because most of them, the family members, they are likely to have that baldness, and they tend to occur this genetic pattern of hair loss at an early stage, but that progresses a little slow, but generally these are very much of concern to the young adults actually.
Okay, quite interesting, doctor. So, doctor, now that we know that what are like when we need to be concerned for. So, another question which is asked by all the people who are like very prone to hair loss, they keep asking why me, why it is happening to me. So, can you please enlighten us like what are the general causes of hair loss? Why does it happen to any of the person? Yeah.
Say of late, many of them, especially the young ladies, they are going for the hair styling procedures or more often. Like they tend to straighten the hair, they tend to curl the hair, and so the repeated heat which is happening to that, it generally breaks normal bonds which are present in the hair. So it may not visible in the early stage as a hair fall, but over the time, what happens is the hair strands they get weakened, and after the certain period of time they tend to notice an increase hair shedding. So one thing what I have generally noticed in the young females is especially about this hairstyling procedures, and a few of the keratin things what they are getting done for a permanent straightening and all those things, and for permanent for curly hair also. And the other thing is, as always said, nutrition plays a very important role, especially in young female ladies as well as in the women, is they tend to be deficient in iron. So that is the thing, they have to look after their diet as well as also get a frequent workups to find out the iron deficiency at an early stage. And also the vitamin D deficiency is also quite very common. So they have also to take the supplements, or at least they have to get that the right minimum amount of sun exposure so that we can synthesize the vitamin D in our cells. So, and the other things is the hormonal reasons, like we can also see the thyroid, and in females especially PCOS pattern, where there is an increase of male type of hormones. So that also causes this hair shedding. So all these factors they need to be considered, and also certain kind of practices like handling the wet hair like inappropriately, like they tend to while drying the hair they rigorously they damp the hair. So that is one of the reason also, because when the hair is moist it tend to be a little brittle, so it can easily break down. While handling the wet hair there should be extra careful. And so these are the things generally what we see regarding the hair fall.
Okay, okay, quite interesting, doctor. So, doctor, like now that we know so many causes are there, one thing it is like we nowadays we all are having poor lifestyle and we don't have time to eat and even working late hours and not sleeping in time. So, can a person lifestyle play a role in hair loss?
Yeah, definitely. See, earlier days, what are the genetic pattern of hair loss? What is it used to be in the late 40s and around, but this genetic pattern of hair loss now, as early as late 20s, we are finding in especially in the young boys. So they were
Mm-hmm.
much concerned. That is mainly because of the pattern or the lifestyle changes that we have acquired over the time,
Mm-hmm.
because many of them are working in the night shifts and they do not have the proper circadian rhythm. So whatever the body hormones, whichever the melatonin, the hormone is getting disturbed. So that is the reason for maybe the early onset of the genetic pattern of hair loss, and
Mm-hmm.
definitely the balanced diet, which is very much missing in our day-to-day life, either because of lack of time and because of the easy availability of delivery food apps. So everybody is fascinated by those things, and so definitely
Yeah.
once in a while having a cheat meal is not an issue, but definitely we have to focus on the food what we eat, especially the amount of the protein we take up in our diet is very important. And we Indians are definitely protein deficient diet, we are more of a carbohydrate rich diet.
Yeah.
So that definitely plays a role. So because hair is also as any other organ in our body, it is a
Mm-hmm.
it is made of a protein, and it does require a protein for its maintenance as well as the growth also. So the main thing is iron deficiency, next is vitamin deficiency, and the protein deficiency, or these
Mm-hmm.
they tend to, so whatever the hair that tends to appear, hair loss that tend to appear at an early later age, now we are going to see in the earlier age. Definitely we can improve with our lifestyle changes, as well as definitely pollution has also has a certain role to certain extent, because of that exposure to the harmful chemicals which are present in the atmosphere, the pollutants, they
Mm-hmm.
also contribute to a little extent to that hair loss. So all these factors, now we have seen the lifestyle changes which are causing the increased shedding of the hair.
Mm-hmm. Okay, quite interesting, Doctor. Like so many nutrients and vitamins can have so much of major role in our hair health. So, Doctor, now that we know what are the causes and why do it happen, so another very common question and like a lot of informations are also there available everywhere in the internet and many people and neighbors also keep telling people about different kind of treatments, but still, patients are quite confused, like what is the right one, and Is there any treatment available or also not for his type of hair loss? So, what are the medical treatment options available for hair loss, like topical or surgical or non-surgical or any other? Like, can you please enlighten us, like, how do a person can proceed?
See, the hair loss treatments, there are wide variety of options are available. But in generally, the first is the most important thing is the microscopic assessment of the scalp of that person.
Mm-hmm.
So we're suffering from the hair loss. So we have an instrument definitely called as a microscope where we go and directly see, examine the hair roots and how is the hair and how is the like the texture of the hair and
Mm-hmm.
is there anything associated inflammation. So for the first and most important assessment part which they tend to have the reason which can help us to find out the reason why they are suffering the hair loss is the trichoscopy. Then after doing the trichoscopy, then we arrive at a particular reason what could be that for the particular individual. And so
Mm-hmm.
sometimes there could be a patchy loss of hair, so we call them as alopecia. So they
Mm-hmm.
tend to have effect in the as early as in the kids and also in the adults. Both are equally affected. So that alopecias we need to find out, and per certain kind of infections, they're especially
Mm-hmm.
common in the kids. So that for we have to find out what kind of infection is it, a bacterial infection, is it a fungus infection. So depend the treatment depends whether it is a bacterial or whether it is a fungus. And next coming to that in females especially, so females what we have, they generally complain of diffuse shedding of the hair or over the scalp. So we could examine, so is it because of the hair shaft disorder or is it because of the genetically certain conditions that are inherited genetically, or it could be something like telogen effluent which is commonly seen in the females. So that is one of them. And in especially in the males we see the pattern type of hair loss, also
Mm-hmm.
called as pattern hair loss or the baldness. So all
Mm-hmm.
these things we can make out, especially by having a close examination of the scalp of the person who is suffering from the hair with the instruments which are available at our clinic for a better diagnosis as well as a better treatment outcomes. So most of them they are now opting for some online regimens and online kits
Yeah.
there. But these are generally the kits are non-specific, they are not directed to your specific treatment. So it is advisable to consult your doctor for better examination as well as a better outcome as well as a better treatment choices available. So coming to treatments, there are wide variety. See, as I've already told you, for fungus, there'll be antifungal treatments, and for this pale pattern of almost there are certain type of medications which have to be taken orally, and certain type of medications which can be applied topically also. So the depending on the cause specific, like what is the reason specific treatments will give you a better outcomes actually.
Mm-hmm. Okay, quite interesting, doctor. So, like specific like treatment options are available, but it is better to go and let your root cause know and then take the treatment instead of taking like blindly taking different kind of treatments and wasting your money and not getting any kind of result. Okay, quite interesting, doctor. So, doctor, like you're saying that nutrients are very important, and any kind of like we can know any you can make hair loss problem. So, there is one word for nutraceutical nowadays. So, can you please explain like what is this nutraceutical and its role in hair health?
So nutraceuticals, yeah, definitely because as we already talked about the nutrition, so definitely any micronutrient deficiency that has to be corrected. So there are certain nutraceuticals which are definitely help in the hair growth because which we cannot take them in diet on everyday basis. So those nutraceuticals and the recommended dietary elements they are formulated in a tablet formulation or sometimes in capsule formulation. So these have definitely a role in especially in the prolonged cases of hair loss where the nutrition might be the cause for that hair loss. Like there are certain like they contain many elements like micronutrients like copper, selenium, magnesium, and a few of them also have a zinc and vitamin D and vitamin B12 also. See the
Mm-hmm.
vegetarians they really tend to be deficient in vitamin B12, so
Mm-hmm.
they have
Mm-hmm.
get supplemented either in the form of these supplements, or they have to, even if they're having the severe deficiency, they might need to go for the injection available also. So the vitamin B12 and calcium pantothenate and biotin and certain these all the nutraceuticals which are helpful for decreasing the shedding of the hair.
Mm-hmm. Okay, so nutraceuticals is important. Doctor, like there are so many herbal, these like plant extract, phytoconstituents, so many information are there on the internet. So, are they very like important in managing alopecia or hair loss?
Yeah, the plasma-based extract, there are many things like soy fluents and green tea extracts and all those things. There are many plant-based extracts now being discovered for the hair loss. Yeah, they have a certain effect in reducing the hair fall, but they cannot completely replace the whatever the available medications which are available. They are definitely an add-on therapy, or we can say it's an adjuvant therapy for the gold standard medications. What we are using for that, they are definitely an adjuvant therapy. Um, for this green tree extract, soy isoflavones, and
Mm-hmm.
definitely omega-3 fatty acids. They also help they reduce the inflammation, whatever at the cellular level. They act
Mm-hmm.
as inflammatory, and a few of them, they tend to stimulate the stem cells in the hair papilla, dermal papilla. So in that stage, they are definitely an helpful adjuvants.
Okay. So, doctor, uh, like in on internet and on social media, it is said that grapeseed, omega-3 fatty acid, do they promote hair growth? Like,
See, they are not directly related, but generally what these are the essential fatty acids. They are not present the body cannot synthesize them, so they need to be supplemented. And they have quite a role in many of the inflammatory conditions which happen, especially in the skin as well as the hair. So they have an anti-inflammatory role, and they tend to help in reducing to the hair loss.
okay. So, so these nutrients are important. So, doctor, in a plate, there are so many nutrients. Like sometimes some people say macronutrients, sometimes people say micronutrients. So, can you please enlighten us with your experience? Like, what are these micro or macronutrients, and how does it play a role in hair health?
Yeah, see, macronutrients are generally what we take. The carbohydrate, protein, and fat are the macronutrients, which our body gets most of the energy. And these micronutrients, they are present. They are essential in little amounts, but they do play an important role in maintaining our overall healthy body as well as the skin, hair, and nails. So the micronutrients, the recommended dietary allowance is also very minimal, but they do have the certain roles like selenium. It has an important role in hair, as well as calcium pantothenate also has an important role in hair, and a few of these like biotin and certain elements like copper. All these definitely have an role especially in people who are deficient in them. They definitely support the hair therapy, and they tend to help to reduce the hair loss also.
Okay. So both macro and micronutrients are important for hair health. So, doctor, after hair loss, another very common problem which is faced by all of us is like dandruff. So, is it very important to take care of dandruff, and can dandruff cause hair fall?
See, dandruff, it is our body, how it reacts to the normal microflora. Like that, there's a fungus called Malcesifer, which maintains the normal scalp hygiene.
Mhm.
So, in some people, what happens, body reacts so excessively to that fungus, which is normally present in the scalp. So, that is evident as shedding of the skin as like a small flakes, what we see as a dandruff. So it is our body protective mechanism, but sometimes it is at an inappropriate level. So that why
Mhm.
we shave see the shedding of that skin as a fine scales. So
Mhm.
it could be a very mild thing, like only there will be only fine scales sometimes visible, and to severe extent, what we can see, like there is a dermatitis picture also, like the skin is inflamed, red, itchy. They have very bothersome with that dandruff problem, and
Mhm.
sometimes it could be the flakes. It could be also a condition called as scalp psoriasis. So
Mhm.
it need to differentiate whether it is only a simple dandruff, or it could be a problem of seborrheic dermatitis, or it could seborrheic dermatitis, that is nothing but a severe inflammation, what we call regularly as dandruff, and we can also see as scalp psoriasis. So dandruff, it can be controlled, but we cannot completely eliminate it. So
Mhm.
it can be controlled with good use of the antifungal based shampoos which are available. They are very nice shampoos
Mhm.
which can cleanse the scalp, as well as
Mhm.
to some extent they decrease the count of that fungus which is present on the scalp, and thereby reduce the symptoms of it. So generally dandruff, we may not directly attribute to hair loss, but maybe because of that inflammation what has happened, suddenly the hair cycle gets disrupted. So
Mhm.
that's the reason why people complain of increased hair loss with dandruff. But as such, the dandruff will not cause an increased shedding of hair, or what we see as a hair loss. It might avoid the already existing problem. So that
Mhm.
is relation between the dandruff and hair loss. And
Mhm.
definitely it can be controlled with good medicated shampoos, as well as overnight applying lotions are available, and definitely it can be controlled.
Okay, okay, quite interesting, doctor. So, doctor, like you talked about lifestyle, and in lifestyle there are like stress is one thing which is like faced by all of us, and it is like unavoidable. So, is there any impact of stress in our hair health?
Yeah, definitely stress flows are made. The hair loss itself causes stress, and stress itself, stress will further increase the hair loss. So it's like a vicious cycle. Like people seeing the amount of the hair loss, they get very much stress. I am not able to concentrate. I am doing so much. Hair is getting lost every day. Suddenly I might go bald. What is this happening? So it's like a vicious cycle. Like because of the
Mhm.
hair loss, I get stressed, and because of the stress, the hair loss gets aggravated. So definitely there are certain stage, if
Mhm.
suppose they might have recovered from severe illness, and they are undergoing some treatments, especially some people, they might have been undergoing some oncology treatments, and somebody have recently they have recovered from his post surgery, or something like that. Those kind of stress also, it can induce a hair loss. So there will be excessive shedding of the hair, so they'll be very much alarmed, so overnight they might go bald and everything. So that stage we call it the telogen effluent. It's a temporary stage, and because all the stage, they definitely, all the hairs have definitely entered into the shedding phase, so they see the increased hair loss. So at that time, definitely hair supplements will do, and also there are certain support serums also which increase the blood supply, and they tend to stimulate the dermal papilla cells, that is the stem cells, so that it gets converted again into the growth stage. So
Mhm.
certain serums as well as the supplements, they do help, and
Mhm.
it's a temporary phase. Generally, it takes time to recover. Within
Mhm.
3 to 6 months, they will definitely, that hair shedding will subside, and they also will restart growing the hair from which the hair loss has happened.
Okay, okay. Quite interesting. So even the stress is very important to manage. So doctor, when we are stressful, the very common formula which is applied by all of us mother at home is the oil massaging. And they also say that if you oil your hair will grow stronger and thicker and longer. So what do you think? What's the fact behind this? Oiling hair is a boon or
Yeah, oiling the hair, it's like subject to debate. It's not directly, hair oil does not cause an increase in the hair growth,
Mm.
but it nourishes the hair, moisturizes the hair, and it's like a preconditioning. See,
Mm.
before a head wash or we can precondition the hair with the oil so that it moistures it, and after the shampoo, what we have used that we not get excessively dry hair, so it acts as a preconditioning, and hair only it moisturizes the hair shaft and prevents them from excessive drying as well as becoming
Mm.
what we call as a frizzy hair. So
Mm.
oil has that role in having the moisturizing effect and also to reduce the frizziness,
Mhm.
but definitely it is not directly related to hair growth, or maybe
Mhm.
because that oil we do tend to some massage with the finger that might increase the hair
Mhm.
circulation, so indirectly it might affect, but it's not directly related like you apply this hair oil your hair will grow long, so that is doesn't happen. So
Mhm.
but we are used to hair oil since childhood. Okay, it's a good habit to precondition your hair so that it doesn't become frizzy after the head wash. So that habit is good. But definitely, in case of seborrheic dermatitis or what we have told about the dandruff, these people they have to limit the oil application to the scalp because that tends to increase their condition. So they need to apply only on the hair shafts, like the
Mhm.
length of the hair, but not over the roots in people who are suffering from severe dandruff condition. So for them, then that might aggravate the condition because the oil it is like a food to fungus which is present in them. So definitely, those people they need to only apply the hair oil over the hair along the length of the hair, but not near the hair roots.
Okay, okay, quite interesting, doctor. So now my favorite part. Can you give us some important tips for healthy hair?
Yeah, healthy hair, have a proper diet, maintain, and proper sleep is also important because everybody has a lot of stress and not giving an adequate time for the sleep. So better to maintain the circadian rhythm, like go to bed early and wake up early. So many of them it's not possible because of this night shifts, and proper sleep, proper diet, balance especially, and uh, good amount of protein, and limiting the hairstyling tools to very less often, I say, like maybe uh, unless it's completely required. So often reduce hairstyling tools, and
Mhm.
next most important thing is don't handle your wet hair very roughly, so the wet hair is very fragile. So while drying the hair, be gentle on your hair, and do use a conditioners, good conditioners that also prevents dryness and oiliness post shampoo, and conditioners are also a certain kind of vitamin E based serums are there which reduce the frizziness of hair, and get a proper evaluation done. That is the most important tip I want to give you. Proper analysis, hair analysis or the trichoscopy analysis will definitely help you to go for the what are the kind of medications you need to use. So
Mhm.
unless otherwise using all those kind of the multivitamins or whatever they are available, so go for the specific tests which are advised by your doctor, have a proper trichoscopic examination done by a doctor, and follow
Mhm.
the medications whatever have been advised you for your healthy hair.
Okay, quite interesting, doctor. This discussion was very informative, and I'm sure our viewers have found the session very helpful. So, doctor, can we take some live audience question?
So,
Yeah. So, there is one viewer which he's been asking questions for a long time. So, he's asking that his age is 22 and he wants to know whether hair fall and hair loss is similar, and what is the minimum hair fall daily maybe. And he's also asking in the same question, can I use onion juice to reduce the hair fall?
I can get the question.
Yeah, so like he's asking too many questions all together.
One
So
thing, what is normal
like
hair?
age
Yeah.
is 22 and
Uh,
he is having hair fall, so he wants to know whether hair fall and hair loss is like same. And he's saying that what is the minimum hair fall daily is like okay to go. And he's also saying that for his hair fall, can he use onion juice to reduce hair fall.
Yeah, see what is hair fall and what is hair loss. See, hair is they're quite synonymously used, but
Mhm.
when we say it is a hair loss, is there is we have noticed a significant amount. See, up to shedding of 100 hairs is normal. Everybody is know, but when you see the severe lumps of hair loss. Or there is a sudden the ball, you can see your ball, I mean, the
Mhm.
scalp, which
Mhm.
is was not visible previously, or happen to see your scalp. So because the density has decreased, so because of the hair loss, the density of the hair has reduced, so you can see your bald patch or this.
Mhm.
So these
Mhm.
are things, and sometimes there will be round patches of hair loss, that
Mhm.
we call as alopecias. There will
Mhm.
be a small round circle of completely smooth patch of skin will be seen. There will be no
Mhm.
hair, so that is an alopecia.
Mhm.
And these are the things, different kinds of hair loss what people complain. So up to
Mhm.
100 hairs, shedding of 100 hairs is normal. So beyond that, what you can see, then it might be of a concern. Then it's a time to just have a trichoscopic examination, what have I mentioned in the video. And see, onion juice, it may act as a irritant. See, it's
Mhm.
like a irritant which might stimulate, but we cannot say like daily applying the onion
Mhm.
juice will prevent you and hair loss. It might helpful in a conditions. It's like in kind of alopecia what we have talked, like there is a smooth round patch of hair loss. There we use a certain kind of irritants to stimulate that the dormant cells which have gone
Mhm.
into the resting phase. But as such, onion juice doesn't directly reduce your hair loss. So I don't think it's a good idea to use only the onion juice or onion hair
Mhm.
lotions to decrease your hair loss.
Yeah, so instead of using these home remedies, he should visit to the doctor and get the trichoscopy test done. And
Yeah,
if it
yeah,
is
definitely.
like he's having a severe hair fall or something, he can get the treatment.
Yeah.
Okay, so quite interesting, doctor. Another question from our audience is, hi, doctor. I want to your appointment because I am also from Hyderabad and I have androgenic alopecia. I have used everything, but no hair grow back. How to get my hair back?
See, androgenic alopecia, it depending on the grade of that androgenic, there are generally grading of androgenic alopecia. So I have already mentioned that it is a familial type, like usually who are the elders in a family, not immediately parents. It could be an uncles or the great forefathers who are have suffering. They it's tend to appear at a
Mm-hmm.
little early stage, and the treatment part is generally depending on the how much in which grade of alopecia you are in. So if you're in a mild to moderate stage, then we can use a certain kind of medications and certain oral medications, as well
Mm-hmm.
along with the GFC treatments, like the growth factor concentrate and PRP treatments are available, which tend to support the hair for growth, as well as to the dormant cells which are the in the resting phase. We can stimulate to certain extent. But if you are in the advanced stage of androgenic alopecia, then there's an option of hair transplantation being done, and that along with hair transplantation, you can maintain good coverage of hair, and along with the hair transplantation being done, you can also have to use certain medications to maintain that hair. So definitely the options are available, but you have to be it takes some little time and effort from your side to get those treatments done. And definitely it's if you can spend some time and effort, you could get a good treat coverage for your baldness, depending on the stage which you are in.
Okay. Quite interesting, doctor. So I'll quickly take the last question from our audience. Hi, doctor. My daughter is 12 years old and she has a lot of gray hair. So why she have such a gray hair in such young age and can it be prevented?
Yeah, see, of late we are seeing the graying of hair at a very early age group. I generally, most of the common thing, what especially in the young children, we are seeing as what the audience has mentioned is because maybe the dietary changes, or because these children, they are like they have a certain food fats, they don't include everything, like certain green leaves, or maybe the vegetables, the different kinds of vegetables have to be included in their diet to get the required amount of antioxidants, as well as the previous thing which we have mentioned, the micronutrients. So the micronutrients to acquire, so they have to include different kinds of foods, especially fruits and vegetables, and especially the protein and the dry food content. So everything, the balanced diet plays important role in to, and it may help to some extent to further we to prevent the further graying of the hair, definitely. And few of the supplements, they are approved for this graying of hair. They could consult their dermatologist to get the appropriate what is the medication for the child. As also certain lotions are also available. Some extent, they tend to prevent the further graying of the hair. So you could mainly focus on the nutrition, as well as please get a help from a dermatologist for the prescribed medications which are available. So definitely they will help to certain extent in further stopping the progression of that graying
Mm.
of hair.
Okay, quite interesting, doctor. I'll take one question from our audience because she's been asking questions. I think her problem is very like she asked that doctor after chemo when will hair come back, and if the hair come back will they be gray and curly?
See, because if somebody is on chemotherapy, what happens is that, see, chemotherapy, they will kill the fastest growing cells. As we all know, the hair is also one of the most affected organ while they're using the chemotherapy. So definitely, the hair will grow back. If after the chemotherapy cycles have stopped, then the hair will grow back. It takes some little time, but definitely it will grow back. It's not like there will be a change in the pattern or something. Definitely your hair will grow back because of that the chemotherapy drugs only, the hair cycle will be affected. And once the cycles are get over, and with proper diet, and especially the protein intake which you need to maintain, definitely your hair will grow back. So don't need to worry about hair loss, especially during the chemotherapy sessions.
Okay, so there is one viewer. She wants your appointment. Hi, doctor. We stayed at Vanasthalipuram. I need your appointment for my hair loss treatment. So
Yeah, you can
I think
please
she can be
Google.
found here.
Yeah. You can Google our clinic. You'll find it, Sridevi Clinic. You can Google our address.
So you can Google her and you can get the appointment. So, doctor, finally, would you like to give any take-home message or any other suggestion to our viewers today?
Yeah. So hair definitely has a lot of importance in our appearance, as well as our social presence. Definitely that need to be taken care, and have a proper balanced diet, proper sleep, and have regular hair care. Just how people, many of them are taking a skincare regimen now. Everybody is doing the skincare, just like once in a 10 days or once in 15 days, you also do a hair care. So definitely that will pamper your hair, and you'll feel have the hair also will have a feel good factor, just how you pamper your skin, pamper your hair once in a while, by having just like moisturizing mask and whatever they are available. And definitely hair needs to be taken care along with your skin.
Thank you so much, doctor. Thank you so much for sharing so much of information and all your expertise with us today and answering all the questions of our viewers today. I'm sure our viewers have found the session very helpful. Thank you so much, doctor. It was a delight to have you and thank you so much for your valuable time.
Thank you for moderating your session for this live session, and also I thank the audience who have joined this live. Thank you.
Thank you, ladies and gentlemen, for joining us today. And thank you so much, viewers, for liking the show so much and asking so many questions and participating actively. We'll get our doctor's appointment again with a new topic here on hair care, and we will cover all the questions again. Thank you so much, doctor, for your valuable time. And let's sign off.
Bye.
Have a nice evening. Bye.